You are watching Hot Springs Village Venues. Dennis Simpson here, back with another episode of Village Venues, and we are so happy to have Mr. Brian Kulis with us today. Brian is a Archie, as I understand it.
I'm an Archie, yes.
And also does this thing called Health and Life and Medicare. And,
I do that, yes. Affordable Health and Life is my company.
Yeah. And you've been around Arkansas how long?
Been here about 17 years.
Really?
Yeah.
So you're a newcomer, is what I'm hearing.
A newcomer, yes. I do like the Razorbacks. I do follow them. Yes, I do, yes.
Well, the reason I wanted to bring up Brian today, he's with Affordable Life and Health, and the bottom line is, I see over and over, if you turn on a television or you get your mail, you're inundated, if you're of a certain age, you're inundated with a particular amount of information about Medicare, and I want to call Brian our local Medicare expert, a local guy who will personally follow up and not a 1-800 number. And I got to tell you, when I call a 1-800 number or they call me and I hear that it's a call center in the background and there's 35 other people talking, I'm like, I'm ready to hang up right now.
Right. And yeah, the problem with that is that you may not get the same agent. You sign up with something with this company, you may not get the same agent every time you call them back. They're from out of state. They may put you into a plan that your doctors are not in the network and things like that. It's a little scary.
How are they going to help me? And we hear a lot about buying local. And that's an important thing. And you're as local as it gets.
I'm as local as it gets, absolutely.
Well,
yes.
But why would that matter when it's insurance or whatever? Well, I mean, is it different between states?
Well, it is. There, insurance licenses are specific to that state. So I have an Arkansas license, and I take a lot of training here in Arkansas. I'm here, visiting the doctors and hospitals and interacting with my local customers. So you get to know the hospital networks, the doctor networks. You get to know a lot of the medical providers personally. And this is something that a call center back in New York or the Bahamas or somewhere aren't necessarily
do.
Right.
Couldn't even come close to.
Right, exactly.
Well, and let me ask, so you talk about knowing other doctors. Now, are you it's not just Arkansas you're licensed in?
I'm licensed in Arkansas, Texas, Missouri, Tennessee, Arizona, and Colorado as well. So anybody in those states too, I offer the plans that are in those states. And I grew up in Phoenix and Dallas, lived in Colorado, so that's why I'm licensed in other areas, because I still have relatives and friends in other states. But I am local here in Arkansas. I've been here 17 years.
Wow, yes. Makes complete sense. Now, and exactly, at a particular age, your mailbox explodes, apparently. It's what I hear tell, right?
Right. Anytime, maybe 64, anytime you're getting near Medicare, you're coming off Medicare disability and new to Medicare, or you're turning 65, the mailbox is going to be stacked this high every day, full of stuff.
Okay, now I'd like to present myself as a younger guy.
Yes.
But for example, you offer Medicare and supplements and Part D for Advantage and whatever. What are we talking here? And what is Part D? Why do I need that?
That's right. There's really, to simplify things, you have original Medicare, which is Part A and Part B, and then you can get a Medicare supplement. You have to pair that with a standalone prescription drug plan, because Medicare supplements don't cover pharmacy drugs. So you have a Medicare supplement paired with a prescription drug plan, or you can have a Medicare Advantage plan, which is an all-in-one plan: doctor, hospital, drug coverage, dental, vision in one plan.
So let me back up for the 5 Mile High.
Yes,
okay.
Sure.
So Medicare is everybody who's worked and been on the Social Security system is going to get Medicare at some point.
That's right. As long as you have worked 40 quarters, so which comes out to 10 years. Right. As long as you have
in your entire life.
Yes, paid into the system at least 10 years, 40 quarters, you qualify for Medicare when you turn 65.
Huh. So I qualify for Medicare, and from the blind vision that I have,
yes,
Medicare takes care of everything, but it doesn't. It just takes care of what, 80% of certain things?
Right. There's Medicare Part A, which is hospital coverage. That takes care of 80%. You do have some deductibles and things you have to pay. Part B is physician services. That pays 80%. Also has some deductible. So that's called original Medicare, Part A and Part B.
Okay.
So that's when people talk to me and they say, hey, Brian, I need a little bit something to help some of the gaps in Medicare, and I want dental and vision, and I want some other things that come along with these plans. That's where they'll either go to an Advantage plan or a supplement with a drug plan.
Well, let me cut to the chase on part of this.
Sure.
So one size could never fit all, because I mean, I'd like to think of myself as relatively healthy.
Right.
And in 2 years I could have diabetes or whatever, and then
Sure.
I go from okay to needing a lot of care.
Absolutely. And that's what I try to find out about customers. I talk to them, find out what their history is, what doctors they have, what hospitals they prefer, pharmacies they prefer. So it really, it's a personal consultation with them. We're going to meet for coffee,
Yeah.
and we're going to talk about these things, because the problem is you call a 1-800 number and they're going to run you through real quick. They may have just 1 or 2 plans. They kind of, here you go.
Well, I was kind of chuckling as you were saying that, because I thought, how on earth could somebody on a 1-800 number know the local doctors or the local criteria or what you need?
It's difficult, and that's what I do. I just want to get to know my customers and their needs,
Right.
by talking to them, having a cup of coffee with them, and just finding out the best plan for them. Like you said, it's not cookie cutter. There could be a husband and wife. One plan is better for the husband, one is better for the wife.
Well, I didn't think of that.
That's correct.
So let's break it down into, once again, I need it simple.
Yes.
It basically comes to 3 pieces, and that's
Sure.
the Advantage,
Yes.
and then the supplemental, and then the Part D that we talk about.
That's correct.
What would I get with an Advantage? What would that do for me?
Well, Medicare Advantage.
And this is a policy you would sell me in addition to the Medicare I have.
The starting point is always Medicare A and B, which
Okay.
is original Medicare.
Which everyone that's been in 10 quarters will
That's
get.
right. You qualify for
Okay.
A, and you could add the Part B.
Okay.
And so an Advantage plan, you look at it as one card for everything. So, okay, you're going to have your healthcare card. Let it be, let's say, United Healthcare, Blue Cross, Humana. That plan is an Advantage plan. One card for everything, for doctor, hospital, emergency room, urgent care. Many of them have dental and vision built into it.
Right.
Some of them have transportation benefit.
Really?
And some of them also have a over-the-counter benefit, where they will give you a credit every 3 months to use towards vitamins, lotions, allergy medicine.
Over the counter stuff?
Yes, they
Really?
give you a credit. And you,
Well, no, okay. I'm once again, I got to have it
Yes.
simple. I get confused.
Yes.
So the Advantage plan, there's not an Advantage plan. There's how many roughly Advantage plans?
many companies offer them.
And many different levels.
Your major companies are all going to have an Advantage plan, and they may run anywhere from a 0 premium. Believe it or not, there's some out there that have a 0 premium up to, let's say, $50 to $75.
Well, let me use me as an example.
Right.
Okay. 59, 6 years away from the magic mark
Yes.
here. Not on any meds, no
Right.
blood pressure meds, none of that stuff. Relatively good health.
Yes.
Would I be better with a supplemental or with an Advantage?
It really depends. Basically, an Advantage plan, you could even have a 0 premium plan. You do have co-pays for a specialist and predictable co-pays, emergency room specialist and hospital, things like that.
Right.
But you could save a lot of money by having a 0 premium each month and just say, hey, when I go to the specialist, I'm going to have a so-and-so copay. I'm going to pay it some towards my emergency room. So, it really depends how much of a chance you want to take. You
Right,
can do that.
right.
On the other hand, you have a supplement, which you're really going to have minimized out-of-pocket costs.
Oh.
But on a supplement, you could be paying $160 a month
Oh.
at a $25 drug plan. So then you're up to maybe $180, $185. Just throwing out some ballpark estimates
Yeah,
there.
and I was going to ask about that. I know we can't talk about exact numbers because we
Right.
don't know exact instances.
Right.
But you're saying an Advantage plan could be as little as
A 0 premium.
really
Right, that's
But then I
right.
would have to pay a deductible or whatever, or
Right,
it could range up to 50 or 60 or $100 or something like this.
Right. Typically, Advantage plans, a good majority of them have a 0 premium for the primary doctor, and your preventative is all paid 100%.
Really?
But you do have co-pays for other things. You go to an urgent care, emergency room, things like that. On the other hand, a supplement paired with a drug plan, a supplement is really going to pay most of all your costs, other than they have a $206 deductible.
Huh.
So after the $206 deductible, typically we'll pay 100%.
Leave it to the government to pick a particular number.
Yeah,
right?
and that
206.
goes up. So that 206 is for this year,
Oh,
and
really?
obviously it's going to go up each year.
So now we're going to talk about this in a minute, but there's
Yes.
a particular window of these things that we can do, right? So we'll come back to that in a second. But
Sure.
when we first talked about supplements, I thought, okay, so this is like a vitamin D or a vitamin K, or what supplement do I take? So
That's right. Yes.
not exactly the supplement
It's
I was
not
thinking.
iron or folic acid, right? It's a Medicare supplement. Basically, it's a healthcare plan where you could go to any Medicare provider that willing to accept that plan.
Okay.
So anybody that accepts Medicare assignment, real flexible, especially someone that maybe is RVing across the country traveling.
Yeah.
Because they can go to any provider willing to accept that plan. No networks.
I was going to ask about that.
Right.
You know, in the village where we're locally located,
Yes.
basically, there's a tremendous amount of people that 6 months of the year, they just travel.
That's
and
right.
I'm like, well, what do you do? So a supplement might be better in that instance. Is
It
what
may
I'm
be
hearing.
better because there is really not a network to worry about.
Oh.
And on the other hand, some of the Advantage plans do also have nationwide networks, specifically emergency room, urgent care, where you can travel pretty freely around the country. So an Advantage plan is also an option in that situation, but the supplements are definitely a really strong option if you don't want to worry about networks
Yeah.
nationwide, and most of them have international foreign
Really?
emergency room benefit.
I was literally reading about that last night.
Right.
I heard about a friend that flew to the UK where
That's
they have
right.
nationalized health care.
Yes.
Broke her leg and had to pay some. But when she got back, she was like, well, I actually paid less than my deductible would have been here, so it wasn't like
Wow,
a
that's great.
$20,000 bill.
Good news. Yes.
Yeah, but now hang on. And the government is notorious for forms and numbers and letters that don't make any sense. Now,
Are they really?
yeah, I know. I know you've never heard that before. You've never heard that before. But like for the $206 and the particular dates and whatever, what is a GN? The GN form. What
That's
are we
right.
talking?
The Medicare supplements all have a letter designation, a
Okay.
Plan G, a Plan N, a Plan F.
They don't stand for anything. They're just G and F.
So what they do is you say, I'm getting a Plan F or I'm getting a Plan G. The Plan F basically paid 20%, Medicare paid 80%.
Right.
So you basically had a plan that as long as you pay your monthly premium, you go to the doctor or hospital, you did not owe anything.
80/20. Yeah.
But the Plan F was, it's grandfathered in. If you have a Plan F, you can still have it. But as of January 1st, 2020, no new enrollees can get into an F.
Really?
So they phase that one out.
Right.
What has become a real popular plan is the G as in George.
And what does that mean? What
The
does it do?
difference is basically that's where I was talking about that 206
Oh, yeah.
206 deductible.
Right?
So a Plan G, as of this year, again, it could change down the
Sure,
road.
sure.
As of this year, it's 206 deductible. Once you pay that, then the rest of the year, really minimal out-of-pocket costs. So, and that's
Well,
a G.
A G.
Yes.
Now, I know that in the village, and nobody wants to admit this, but there are some, shall we say, better off, more well-to-do village members.
A few, I
A
think,
couple.
yes.
They won't tell you they are, but they are. And is there a limit? Is this any of this income-based or limited or whatever?
No, really the only thing that is income-based, well, actually there's a few things. The supplement Advantage plans are not based on income, so everybody basically pays the same price
Right.
on a G plan as your neighbor does.
Huh.
Where it's going to be different is on the Medicare Part A and B, you're going to have a Part B premium. And your Part B premium to original Medicare could be higher if you are a higher income individual.
Oh, okay.
And that's really one situation where that only involves Medicare,
Part B.
original Medicare.
The original Medicare.
Right. And then also, if we talk about some of the programs like Extra Help, Arkansas Medicaid, that's where you would run into, it's based on your income, your household income.
Now, is that for lower income?
Not necessarily. I mean, there's, Arkansas Medicaid, your Extra Help program, There's quite a few people that can qualify for it. So.
You know, what I'm hearing repeatedly is
Yes.
that I need a local expert who will
Yes.
help me with this.
Local expert, yes.
This is beyond a simple question. And I'm talking to the audience just for a moment. I want to say,
Yes.
if you're looking for a human that you can talk to and know that you can call back and get the same number
I'm a
every
human.
time. You're a human?
Yes, I am.
Who knew? Who knew? But for to talk to Brian and have a local expert, I mean, here, your number is 501-922-7449.
That is correct.
Is that a 1-800? Is that a out-of-state number? That's a 922 number in the village.
Hot Springs Village number. Yes.
And you can't get more local than that.
I'm very local, yes.
Very
Yes.
local. Well, I'll tell you what, and let me cut to one more, Chase, and we need
Sure.
to finish up here real quick with this episode. So the enrollment begins...
October 15th through December 7th is the annual enrollment period. That's when
Okay.
people can change plans if they desire to. So somebody is looking at new plans. There's always new plans coming out. Again, they can call me. They can switch plans. I have all the new brochures. Again, that's another nice thing about a local agent. I'm going to be apprised of all the new changes and new plans coming out because companies are always changing every year. On the other hand, if somebody wants to stay in the plan they're in, they could stay the course.
Sure.
And there's also other special enrollment periods, like if you're turning 65, you move to the area, or you're new to Medicare from disability.
Right.
That can be at various times during the year.
But I want to come back to this, just
Yes.
extremely simple as it can get.
Yes.
If I don't know somebody local, I could, and for example,
Right.
I guarantee you there's somebody watching right now that went, you know, we
Yes.
saw this football player on TV, and I remember him back in the 70s, and I saw him, and I called that 1-800 number, and I talked to Hameen, and Hameen got me set up on a plan, and I'm not happy with that plan.
Right.
October the 15th through the 7th, December the 7th,
That's-
I can change that plan, but that's the only time I can change, right?
That's the only time, unless you're specifically a lower income individual, where that opens up other situations. And so that's where, again, this gets real complicated
Right.
at times.
Because I'm locked into that plan until October the 15th.
A good majority of people are, yes.
Really?
October 15th through December 7th, they can switch plans, and then that plan starts January 1st of the
Wow.
next year. So, yeah.
I don't think I can make it any more clear to our viewers. The bottom line is you need somebody local. I would suggest Mr. Brian Kulis, but that's my personal bias.
Thank you so much.
You're very welcome. And you see the number across the bottom, 501-922-7449, the local number for Mr. Brian Kulis, who apparently likes coffee.
I love coffee, yes.
So apparently
Oh,
you like
yum.
coffee and you want to sit and talk.
That's good. Sounds good to me.
You know
Right.
what? That's rare in today's society. It really is. For Hot Springs Village Venues, Dennis Simpson, Mr. Brian Kulis, we will see you next time. Thank you for watching Hot Springs Village Venues. Please stay tuned and follow us on Facebook to see the next episode.